Welcome to the Be There movement for bipolar disorder and my podcast about bipolar disorder. This is a broad overview of bipolar disorder. My name is Dr. Linsey Willis, and I am the author of Be There, My Lived Experience of My Sister's Bipolar Disorder. Thank you so much for tuning in. We will cover these topics during the presentation. And for those of you who are suffering from bipolar disorder or think you might be suffering from this mental illness, or you're a caregiver or a family member or whomever, you will learn a lot from this presentation today. It's based upon extensive research that I did that's been published or out there in SlideShare, which is based upon research scholars did, and then they published it on SlideShare. It's open to the public domain, but you have to have a subscription. So I just want everybody to know that this is research-based. And I cite my references at the end of the presentation. Let's start with the biopsychosocial approach. And this assumes that biological, sociocultural, and psychological factors combine and interact to produce psychological disorders. And we know that my great-grandmother suffered from bipolar disorder, although it was not empirically validated at the time, but we have a lot of anecdotal information about her behavior. So as you can see from this visual, there's a connection between these different influences. How common is bipolar disorder? 46 million people around the world, including 2.8% of the US population, have bipolar disorder. One survey of 11 countries found the lifetime prevalence of bipolar disorder was 2.4%. Now, this may not seem like a large percentage for these two sentences here, but it is quite large, particularly if you have had experience dealing with people who suffer from bipolar disorder. It does have a great impact on your life. And so it doesn't matter that the percentage is small, but it matters that you have dealt with this illness. On average, bipolar disorder results in 9.2 years reduction in expected lifespan. I can validate that this is true. My sister died at age 67. I truly believe that had she not suffered from the illness and all the medications that she took over all those years, which eventually, I think, breaks down the body, and she survived a horrible fire, which is covered in my book, she would have lived longer. Up to 60% of people with any mental disorder, including bipolar disorder, develop substance abuse disorders. Here is a graphical representation of bipolar disorder. And as you can see here, the good times are in the middle, and the mania and the depression are on the bottom and top parts of the representation. My sister was a rapid cycler. She went up and down every 24 hours or so. And this was presented to me from my sister as well as doctors I spoke to at the facility she was staying at during treatment. Here's another depiction of bipolar disorder with respect to the different phases somebody goes through and what they call those different phases of the disorder. Regarding brain structure and functioning, this is very, very important because brain image studies have helped scientists learn what happens in the brain of a person with bipolar disorder. And they take pictures of living brain. And some studies show how brains of people with bipolar disorder may differ from brains with people who are healthy. And one study using MRI found that the pattern of brain development in children with bipolar disorder was similar to that in children with multidimensional impairment. Here's a picture of the bipolar brain in the red and the normal brain in blue. And the biological approach to bipolar disorder suggests that high or low levels of neurotransmitters in the brain, such as dopamine, serotonin, or norepinephrine, are the causes. So there is hope, even when your brain tells you there isn't. This presentation provides a lot of information, as noted previously, but you will find hope by listening to the presentation. Here are some other pictures of the bipolar brain. Very, very interesting, and look at the different colors. Brain disorders are diagnosed by neurologists, neurosurgeons, and neuropsychiatrists, and they can get this information from CT scans, EEG, MRIs, etc. And then there is the Diagnostic and Statistical Manual of Mental Disorders, which is known as the DSM-5-TR, and it's a handbook used by these individuals, published by the American Psychiatric Association, and it covers all categories of mental disorders. I remember my sister used to have a copy of that book. She would love to try to self-diagnose herself, and she really thought she knew more than the people treating her. But then again, she possessed a master's in social work with a focus on psychiatric, and an undergraduate, I believe, in social work or some psychology degree. And her master's was from the University of Pennsylvania, which you all should know is an Ivy League school and difficult to get into. Here's a picture of the brain where they show where some of these disorders lie on both sides of the brain. And with respect to the bipolar disorder part of the brain, there is what is known as the gray matter. And unfortunately, the experts have surmised and validated that with each successive episode of mania or depression, the gray matter is destroyed. I know my sister, as she aged, it became more difficult for her to recover from one of these phases. There's hope, ladies and gentlemen, and you're not alone. There are famous people in history who suffered from bipolar disorder, and it is known that during their manic phases, they were very, very creative. Walt Whitman, Virginia Woolf, Samuel Clemens, Mark Twain, Ernest Hemingway. And Hemingway, famous writer. I read a few of his novels in my modern novel course. He tried to kill himself several times, and he finally shot himself in 1961. If you ever come to Florida, or you live in Florida and you haven't been to Key West, go to Key West and go to the Hemingway house. You'll meet his six-toed cats, which, according to what I've been told, they're all descendants of the original cats that were in the house when he was there. Here's a figure regarding symptom domains of bipolar disorder. On either side here, manic or depressed side, or the psychotic symptoms, or the cognitive symptoms. Let me just focus on a few of my sister. She was definitely reckless, shoplifting. I covered that in my book. She cracked up a car and then never drove a car again. I referred to it as promiscuity, but she had an excessive libido. She was never without a man her entire life until after her boyfriend of 9 years passed away. They lived together in the assisted living facility. The social intrusiveness characteristic I covered as bizarre social behavior, but it could be very, very embarrassing when you're with her or someone with bipolar disorder who just goes up to somebody they don't know and starts talking to them or asks them for something that belongs to them. It's just very uncomfortable, but that's part of the illness. My sister experienced racing thoughts, distractibility, inattentiveness, and so forth, all at one time, and it could be very difficult to deal with. Look at this. This is the depiction of, or one depiction of, a person who is manic and is thinking about all these things and putting stickies on the wall and writing on the stickies and just going crazy for a while. They could actually do this and finish it in a certain period of time. And this is the depiction of somebody who may have been manic because of all the things they were able to do and tidying everything up. And then they crashed and became very depressed and they couldn't clean their room up. And this is what was the result of the crash and the depressed state. With respect to bipolar disorder and schizophrenia, they share common susceptibility genes on chromosome 6. And these genes are located in a section of the chromosome containing genes involved in immunity and controlling how and when genes turn on and off. And this connection can help explain the link between environmental stress and schizophrenia and possibly bipolar disorder. And here's a depiction. You see here, this circle is an overlap between bipolar disorder and schizophrenia in terms of the letters and numbers assigned to those particular genes. And another figure here, the X and Y axis figure, and this shows the percentage of patients in the study who demonstrated these types of behaviors. And the tallest bar chart reflects 53.9% of these individuals in this particular study demonstrated or self-reported more than 4 symptoms in this category. And the larger part, the blue, lighter blue, 1 to 3 symptoms. Moving on to questionnaires. These are important because these are used to determine the extent to which somebody is suffering from bipolar disorder based upon the scoring of these instruments. And you would be administered these instruments by a psychiatrist, or more than likely a clinical psychologist working alongside the psychiatrist, or a qualified social worker at a facility, and they would score it and give you the report. So the mood disorder questionnaire has 13 questions on manic symptomatology, and it can detect bipolar 1, but is less sensitive for bipolar 2. And it's a positive screen if at least 7 symptom items are identified. Moving on to the bipolar spectrum diagnostic scale, it consists of a descriptive story that captures subtle features of bipolar symptoms and the courses. And it has equal sensitivity in detecting bipolar 1 and bipolar 2. And it consists of 2 parts, and there are 19 statements the patient is given to read, and they place a check mark next to the statement that describes themselves. Now, this assumes, and all these questionnaires assume that the person is being honest, okay? And if a person receives a score of 20 to 25, there's a high likability, that they are suffering from bipolar disorder versus the lowest score, 0 to 6. Let's move on to medication adherence. This is very important because it is known that people that are on a medication or medications for bipolar disorder oftentimes stop taking their medication. I read a figure in one of the documents I read that 50% of the people on medication stop taking their medication. And the definition by the World Health Organization is the degree to which the person's behavior corresponds with the agreed recommendations from a healthcare provider. And here's the scale. This is important. You can give this questionnaire to the person and ask them, do they ever forget to take their medication? I take my medication when I'm sick. My thoughts are clear on medication. I feel weird, like a zombie on medication, which leads us to the causes of medication non-adherence. These are reasons why people stop taking their medication. So if you're a caregiver, and the person lives with you and you help them monitor their medication, you can monitor these behaviors and encourage them not to be fearful and so forth. If a person takes too many pills, they can overdose, etc. People may mistrust the health system overall, but you can try to dispel those feelings. These are examples of tendencies towards suicidal potentiality. And I have hands-on experience with this with my sister, as well as my dear deceased husband, Frank, who sadly passed away from dementia. And he was given psychological questionnaires, which identified that he was having a cognitive decline, and his executive functioning was going downhill. He was devastated by this. They put him on the best drug on the market for about 6 years. He was on Namzaric. It's a combination of two of the best drugs on the market. And he said he didn't want to live anymore. He said I knew he was extremely depressed. He became grumpy and, didn't want to eat, didn't want to get out of bed, didn't want to talk to me, and, just said, I'm done. I'm ready to go. I don't want to live anymore. At which time I called the police, which is the first step. You need to call the police because they're the ones that are going to facilitate the process of you getting into a hospital and Baker acting the individual. So this is very important because you can save somebody's life. And through this process, this person who may never have been diagnosed with bipolar disorder may finally be diagnosed by professionals and receive the help they so well deserve. These are additional risk factors of bipolar disorder, of suicidal tendencies. You can help with these things to prevent a suicide attempt. And for example, I'm going to pick on two of these. Legal problems. My parents were threatened with lawsuits a few times many years ago because the people said my sister's behavior was weird. She was evicted. They didn't sue my parents. Regarding financial problems, fortunately, she didn't have the financial problems a lot of people have because we were able to subsidize her Social Security disability. But with respect to suicide prevention and potential causes of suicide, these are all examples of what can trigger a person's desire to end their life. Now let's talk about briefly some case studies. Patient A, patient B, they ended up being successful after being diagnosed in terms of their lives. And the lessons learned from these first two case studies is the importance of personalized, compassionate care. John was a 32-year-old software engineer who had been experiencing mood swings for several years. His first manic episode was at age 28. His family noticed all his bizarre behavior listed there, and he sought medical help. And this behavior is bizarre. And you may say something to the individual, before you finally encourage them or take them to the doctor or Baker Act them. And they think there's nothing wrong with what they're doing. They think that you're the one that is the problem and everything that they're doing is fine. Well, following his manic episode, he fell into a very, very serious depression. And because they were concerned for safety, they took him to a psychiatrist. He was diagnosed with bipolar disorder 1. He was put on the appropriate mood stabilizers. He engaged in cognitive behavioral therapy, and he got better, and he had ongoing treatment, and he had regular exercise, which is extremely important. And so he was able to manage his condition. Case study 2, Emma, a 38-year-old graphic designer. She was diagnosed with bipolar disorder 1 at age 32, although she had suffered many mood swings since her late teens. It's sad that she didn't get help at that particular time, but there are many reasons why people don't seek help, some of which we've already talked about. They don't think there's anything wrong with them. They just think it's normal behavior, for example. So she had grandiose delusions, and her erratic behavior prompted her family to seek medical help. And she took leave from work because of her serious depressed episode after the manic episode. And she was diagnosed with bipolar disorder 1, and she took lithium, olanzapine, and started cognitive behavioral therapy. And in the end, with all the therapy and the family help and going to family therapy sessions and developing coping strategies and going to a support group, she was gradually able to return to work. So, ladies and gentlemen, there is hope. People can live fairly successful lives or successful lives overall if they get treated and are on the right medication and stick to the plan. Case study 3, very short study. This 35-year-old male was forced by his family to go for treatment. He had not slept in a week. He had been busy writing a novel. His aggressive behavior indicated from his children they were afraid of him. And he also started using recreational drugs, possibly to sedate the mania and thinking that he would feel better by it or whatever by using those different drugs. He was also flirting and acting inappropriately with women. He was fired from his job and didn't think it was a big deal. Moving on to the evolution of therapies for bipolar disorder, starting in 1940, electric convulsive therapy back in 1940. First generation drugs around 1950. Lithium, which is still widely used. These drugs, one you probably have heard of, Thorazine, Halidol, and then you've got anticonvulsants and other anticonvulsants that came around in 1990, and then second generation antipsychotics and antidepressants. But antidepressants, based on the research, have had some problems. They may not work, okay? And based on mounting evidence, they actually don't work for people. But of course, this is just based on that and that particular sample size. So at least we have that information that an antidepressant can trigger mania or can increase mood cycling. So that's why medications need to be monitored. And if you're a caregiver where the person's living with you, could be your child, your teenager, your adult child who's living with you, or your husband or wife, you need to help them monitor their medication use. Moving on to this visual about lithium. My sister was on it for 9 to 12 years. It was a miracle drug for her until she overdosed. And you see here the phases, and then down here you're adding an atypical antipsychotic, and you add other drugs as you're going through these phases. You're not just taking one drug. Chronic lithium toxicity. My sister overdosed on it and could no longer take it. I remember her hands were trembling. She got very sick and nauseous. She told my mother all of this. And then after she could no longer take that many years ago, she went in a downward spiral, and it took many, many years to find the right medication. And these are some other symptoms of lithium toxicity. And moving on to complications of bipolar disorders. And when I say disorder, manic or depressed, it's not just one. These are all very important, and you need to monitor these and be proactive instead of reactive. You need to pay close attention to these indicators. For example, if you know that your husband or wife or friend is having problems at work, and for example, keeps getting fired from his or her job, but blames it on the system, and then you notice all these other behaviors, and they're having relationship problems, or your teenage daughter or son is having problems in school, and the guidance counselor calls you. Don't blame the system. Don't blame the teachers. Look at yourself in the mirror and say, what can I do to help this person? Don't get into this thought process where, it could never be my child or my son or daughter. We don't have mental illness in our family. Oh no, not us. Or how could this happen to us? Well, it happens to people. And unfortunately, it's okay to talk about your diabetes with close friends, or your heart disease, or you're recovered from your heart disease, or you've got lupus, or you've suffered from breast cancer, but you're in remission. It's okay to talk about those kinds of illnesses, but it's not okay to talk about mental illness. It used to be in the closet. People would say, "Oh God, I'm not. Don't you dare tell anybody." My parents felt that way. What are they going to think about us? God forbid anybody knows that our daughter is suffering from bipolar disorder. We need to bring it more out in the open. It's okay to talk about it. It's okay to share with people that you have it. People are talking about it on TikTok. People are talking about it in Facebook groups. People are posting stories about themselves on YouTube. I've listened to some of those YouTube stories. So people are becoming more brave to share their stories. And the Be There movement is here to facilitate that process. We want you to be open. We want to talk about this. If you donate to my website, if you buy my book, if you attend wine tastings that we have, that money is going to be given to the Betsy Craig Foundation. So we make the world more aware of bipolar disorder through the Be There movement for bipolar disorder, because there are many, many complications. We're all in this together, and we need to take action and have respect and understanding and empathy for people who are suffering versus this viewpoint. Oh my God, they're mentally ill. I'm gonna get away from that person. I don't want anything to do with that person. I don't want to be associated with someone who has mental illness. That's not the attitude to have. So treating bipolar disorder, yes, we've already learned a little bit about treating bipolar disorder. And some of the reasons why bipolar isn't treated properly is because it's misdiagnosed, or there's a very late diagnosis. So in other words, a person's lost many years of their life that could have been better had they been diagnosed, had they been willing to go for treatment. A total of 60% of those in this particular study were diagnosed with major depressive disorder, with 1/3 going 10 years or more without a correct diagnosis. And in addition, these patients in this study had an average of 3.5 other diagnoses and saw an average of 4 physicians before receiving the correct diagnosis. Don't give up. There is hope. Continue on with seeing doctors and doing something about this. And the caregivers can help the person deal with this. Remember, there's nothing wrong with having bipolar disorder. It's genetic. It's a chemical imbalance of the brain. It's not your fault. It's okay. We're here for you. Famous stars and rappers have made it public that they suffer from the illness. Selena Gomez went to Harvard University Hospital, McLean Hospital, and she realized she was bipolar. And she said, "So when I know more information, it actually helps me. It doesn't scare me when I know. I could take a deep breath and go, okay, that explains so much." Kanye West, in a 2019 interview with David Letterman, said, "I feel a heightened connection with the universe when I'm ramping up. It's a health issue." So when you're manic, you think you're invincible, you can do anything, you're great, you may not sleep for days, you're very productive, but unfortunately, then there's the depressed side where the person crashes, and the crash can be so bad that it could actually end in the person taking their life. Other famous people who have suffered from bipolar disorder, all of these individuals in history. Vivian Leigh, famous movie star. I saw her in Gone with the Wind more than 10 times. Scarlett O'Hara, quote, "Throughout her possession by that uncannily evil monster of manic depression with its deadly, ever tightening spirals." She lived with it her whole life and died in 1967. Ladies and gentlemen, there is hope. The illness is more out in the open than it was in the past. These other celebrities have shared information about themselves. Mel Gibson, and these other individuals here, you know them, Catherine Zeta-Jones. And we need to think outside the box. People who are creative geniuses were able to do so. Wolfgang Amadeus Mozart, Virginia Woolf, Salah Jahin, Alman Tanabi. Okay, there is hope, ladies and gentlemen. There is hope. We're all in this together. Please go to my website and purchase a book. I'm going to eventually have the ability to have people buy the audiobook from my website. We'll have a donation site. The money will go to the Betsy Craig Foundation. This is going to be a worldwide movement, the Be There movement for bipolar disorder. Thank you very much for being here today, and have a great, wonderful rest of your day.